If you're looking for a way to transform your smile without the hassle of braces, you don't want to miss this video. We'll be sharing with you everything that you need to know about how dentists choose the best aligner system for their patients. By the end of this video, you're going to be equipped with all the insider info to help you make an informed decision about your dental treatment. So sit back, relax, and get ready to discover the ultimate guide for selecting the right clear aligner system. So step 1, assess the severity of the malocclusion. As you may already know, malocclusion is a dental condition that occurs in your teeth, and it's when your jaws don't fit together properly. This can cause a bunch of different problems. Things like difficulty chewing, speech problems, and it can even affect your self-esteem. Fortunately, there are several treatment options out there, including clear aligners. Aligners are clear plastic trays that help move your teeth by putting pressure on them. However, not all aligner systems are created equal. Some are going to be better suited for mild cases, some are going to be really good for moderate cases, and others are going to be really good for severe cases. Therefore, it's essential to assess the severity of the malocclusion and determining the system that's going to be best for you. During the initial consultation, your dentist will carefully evaluate your teeth, your bite, your x-rays, and determine the severity of your malocclusion. Based on their evaluation system, they will recommend an aligner system for you. If your malocclusion is mild to moderate, your dentist may recommend an aligner system that's a little bit more streamlined. There also may be a difference in price, and these might be cheaper. Every office is different, so don't take my word for it. Just letting you know what's out there. Now, if your case is a little bit more complex, a little bit severe, you're probably going to get a recommendation for a different system that's going to be best for you. That's also maybe a little bit more of an expensive treatment. But remember, you're investing in your oral health, so the price should not matter. Overall, it's essential to choose the right system for your situation. Your dentist is going to be able to give you all the recommendations. Now remember, not every dentist offers a bunch of different systems, and that's okay, because as long as they've done the research on the back end to see what's the best system for the patients that they can treat and the cases that they can take on, you're gonna get a great system. So you don't have to worry about doing all the research, but definitely have a conversation with your dentist to see why they chose that system. Step 2, consider the patient's age. It's important to know that patients' age play a significant role into clear aligners. For younger patients, the teeth and jaws are still developing, so certain aligner systems may not actually be effective at moving teenagers' teeth. For example, some aligner systems may require to have fully erupted or for certain jaw growth to have occurred before treatment can even begin. On the other hand, some aligner systems are just better suited for adults who may have more complex alignment issues. Adults may also have existing dental work or restorations that need to be considered when selecting the appropriate aligner system. Moreover, age can impact your overall health and the success of aligner treatment. For example, older patients may have more significant bone loss or perio disease, which could impact the effectiveness of certain aligner systems. Therefore, it is crucial to take into account your age and overall health when selecting an aligner system. Look, as a patient, you want to ensure that your treatment is going to be successful. That's why it's important to work with your dentist and ask questions and get involved in the process. This way, you can find the best system for your situation. Step 3, evaluate the patient's compliance level. Do you have aligners? Are you ready to commit to wearing plastic in your mouth for 22 hours a day? That's what it takes for successful aligner treatment. So when it comes to aligner treatment, compliance refers to how well a patient performs when it comes to the treatment plan. So this includes wearing the trays for the recommended time and switching into the new ones when it's time to do so. And compliance is literally the key to success for clear aligners to work. If you don't wear the trays, the teeth will not get forces put on them, and then the teeth will not move. It's that simple. You don't wear the trays, the treatment doesn't work. That's why when patients are highly motivated and committed to improving their oral health, those are the patients that are going to be way more diligent and willing to follow the treatment plan as prescribed. If you're a patient that you have a busy schedule, you travel a lot, and you're not good at forming habits, you may not be the best aligner patient out there. I'm not saying you can't get it done. I'm just saying you really have to dig deep and see, are you committed to improving your oral health and going through with this treatment? Another thing to consider is the frequency of having to change out your aligners. Some systems require you to change trays more often than others. Some systems you can wear them for 7 days, other systems you can wear the aligners for 10, and some others they will require 14. Again, these are questions you should ask your provider. So to wrap this part up, compliance is huge. If you don't comply, the treatment won't work. Make sure you know how long you're supposed to wear the trays for before you commit and jump into treatment. I want to take a quick second and talk to all the dentists who are watching. If you're ready to elevate your patient care and expand your skill set, and you're wondering how you can start offering aligners to your patients, I have an exciting opportunity for you to learn how to do so. It's 100% free, and it's a masterclass where I walk you through exactly what you need to know to start doing more cases with confidence. The link for it is in the description below. Check it out and I'll see you there. Okay, back to what you need to know about choosing the right aligner system. For step 4, you need to assess the patient's lifestyle. So with aligners, it's not just about your teeth and bite. Your lifestyle can play play a significant role in determining which system you should go with. For example, if you play contact sports or other physical activities, you need to make sure the system can withstand that. Fortunately, there's certain brands out there that have more durable aligners than others. Others may be more likely to break or become dislodged because a little bit more delicate. So if you're someone that's super active or an athlete, going with a more durable system is going to give you a better result just because it's going to be a lot less likely to break. It's not just sports that can affect your aligner system. It could actually be your job too. If you have a job that requires a lot of public speaking or you're in meetings all the time, you're probably going to want to go with a system that is a lot more discreet and streamlined. Patients usually have trouble speaking the first 7 days when they first start their aligner treatment. This is normal across the board. This is because your tongue is now touching a piece of plastic and it's not touching the back of your teeth that it's used to. So when you do that, there's an adjustment period in your speech. You'll eventually get over it and you'll be talking normal after, but just know that is across the board. Okay, step 5, discussing treatment goals. When you're starting treatment, you need to discuss what are you actually trying to get out of this treatment. Talk to your provider about this so that way you both are on the same page. The worst thing that we see is when patients don't really know what they want out of treatment and the provider has something that they want out of treatment. And then you go to the end of treatment and nobody's happy because the patient didn't even know what they were signing up for and the provider is not happy with the results. Being satisfied with results requires two parties to be involved. As a dentist, I defer to my patients. I always like to address the chief complaint, which is the main issue. What are we trying to solve here? Are we trying to align your teeth so they look better? Are we trying to align your teeth so we can prevent you from getting a lot of gum problems? Are we trying to align your teeth to even out your bite so you don't wear your teeth down? These are things that I like to be upfront with my patients and establish from the beginning. So that way when we get to the end of the treatment, everybody's on the same page. And if we need to continue to further tweak and move the teeth, we both know why we're doing it. But also if we are done and happy with where the teeth are at, we know when we can stop. This is a huge mistake that so many providers make. They don't establish the goal of the treatment. So for you as a patient, you also need to have an idea of where you're going. What is your journey going to look like? So that way when you get to the destination, you know you're at the destination. So there you have it. Choosing an aligner system is going to be critical for your dental health. I hope this video provided some value for you so you have an idea of what questions to ask your provider before you start treatment. If you have any questions, feel free to comment them below. Also, please drill that like and subscribe button for more clear aligner content. If you found any value in this, please feel free to share this with any friends, family members, or even your dentist. I'll see you guys in the next video. Thanks.